Hello, good afternoon, good evening, and good morning to everyone joining our weekly live Q&A with Dr. Mike Ryan and Dr. Maria Van Kerkhove on COVID-19. Today we will cover also other health emergencies. So if you have questions, as usual, please use the hashtag AskWHO if you're watching us on Twitter. And if you're watching us on Facebook, LinkedIn, or YouTube, please ask your questions using the comment section. And I will be glad to pass your question to Mike or Maria or both. Good afternoon to Mike and Maria. Thank you for your time today. We just finished 75th World Health Assembly last Saturday. It was a long one with a lot of items to discuss, and a lot of items that member states discussed were on health emergencies. So Mike, can we maybe start with an update? What are the outcomes and decisions made by member states in this assembly that are impacting each and every of us in the COVID response, current emergencies, but also for the future ones?
Great, and hi to you. Yeah, we had very, very intense 7 days. First time we've been together face to face at the World Health Assembly since 2019, so it was very nice to engage directly with people again. There were still some restrictions in place in terms of numbers and other things, but it was good to meet with people. We finished, I think, 11:27 p.m., I think 30 minutes before the deadline. I think they were going to switch the lights off on us at that point. So we just got everything done. It was, I think, one of the largest agendas for an assembly ever. I think there were 73 or 75 agenda items, which was a huge task. But again, after so much time not being face-to-face, I think the member states really wanted to get a lot of discussion, not just on emergencies. In fact, what's great about the Assembly this time is they really got into issues around universal health coverage, around primary health care, around health promotion, health protection, around so many other issues that are so important. They talked about food safety, strategies for food safety, strategies for the immunization agenda for 2030, around the health workforce and training more doctors and nurses and physiotherapists and generally healthcare workers in general, non-communicable diseases, neglected tropical diseases, TB, malaria, lots of roadmaps and strategies that were agreed and presented. Big discussion on polio eradication as well, and we had technical presentations on COVID and monkeypox, thanks to Maria here and also to Sylvie Briand and the whole team. So we weren't only working in the sessions, we were doing lunchtime sessions, evening sessions, so it was pretty intense. From our perspective, in terms of the emergencies agenda, I think the big things were the working group on preparedness and response reported. This group have been working for the last 2 years, pulling together recommendations from different groupings to really distill out what WHO should be doing in future. The DG presented his vision paper for the architecture for health emergency preparedness and response going forward. That was very well received. So I really felt we started to get some momentum in terms of what we do to learn from this pandemic. But I think all of us kept saying, and thankfully the member states as well, that the pandemic is not over. There's still a long way to go in terms of what we need to do, in terms of vaccination, surveillance, genomic sequencing, treatments and everything else. But also there was a recognition that we need to learn from this, move on, and that we need a strong architecture and a strong strategic approach to ensuring that we do better the next time. So lots and lots of stuff on the agenda, a very, very intense week, but I think very productive. And I think reflecting too, Alex, the fact that 194 countries come together representing their populations, and they discuss these matters of health. And they discuss this not as a way of giving up sovereignty, but as a way of sharing responsibility for the health of the world and finding ways to develop common strategies, common approaches, that allow us all to achieve the health goals in every country.
Thank you so much, Mike, for this overview of what has happened last week. And besides those big debates that member states do together in different sessions, WHO experts also meet one-on-one with member states representatives during this week on what are the health needs in different countries. So, Maria, maybe you can summarize from those meetings, what were the main asks or needs when it comes to COVID response from member states when you were meeting them?
So I can start, and Mike should definitely supplement, because these were quite fascinating meetings that we had on the sides of WHA. You know, we have these opportunities to meet with ministers of health, with CSOs, with NGOs, with countries that are dealing with the COVID-19 response. And what I found so interesting about these discussions, first and foremost, they're one-on-one, so you can really get into the details of what they're dealing with and how they are managing COVID-19 into this third year. But you get into the details of what that actually means. And what we were able to distill from these discussions is the complexity of the response, how challenging it is for ministries and governments to maintain this momentum for dealing with COVID-19. All of them recognize, and quite vocally, that the pandemic is still prominent, it's still occurring globally. Some countries have managed to end the emergency in their own country. And the way that they've been able to do that is through the strategic use, epidemiologically appropriately, ethically appropriate use of tools, focusing right now primarily on vaccination, and not just vaccination coverage at the population level, but who in those risk groups, in those over 60, those over 70, those over 80, those with underlying conditions, how many have they reached? And Mike and I had a lot of really good opportunities to talk to them and say, okay, among that's great that you've reached such high coverage, but who within that population have you missed and why? And there's a lot to be learned in that setting. It's not just about hesitancy. It's about being able to reach these populations. It's about being able to reach the medical professionals that deal with populations that have underlying conditions, and really fine-tuning, if you will, the response going forward. There were lots of questions about the additional use of boosters and the use of vaccines going forward and what that would mean. But governments also recognize the importance not just only of vaccines, but also of these other measures. They expressed the challenges of keeping in place the use of masks in indoor settings, for example, the challenges that poses from a population level, because people are just so tired of talking about COVID, which we all recognize. But it was very helpful to have those one-on-ones. What we can do at a global level is we can outline how countries can exit the emergency, how they can really use the tools at hand. But we can't be prescriptive of saying this is what every country should do in this order. What we've outlined are the tools, we've outlined the considerations of what countries need to do. And what was good for us, I'll speak for myself, it was so good to hear from them about how they are adapting those tools and making it work in their countries. And every country is different. Every country has different levels of income within their populations. They have urban, they have rural. Some countries, are made up of thousands of islands, so they have very hard to reach populations. And for me, it was really informative to listen to them, to hear how they are making it work, balancing the needs of COVID-19 to continue to be vigilant, because they all recognize, I think every one of them asked us about the variants. Every one of them asked us, okay, what's next? Like, what will it be? And what can we predict? And so they recognize the need to maintain that. But it was nice to be able to have those really detailed discussions.
Yeah, and it's, I think I was impressed because been at this for quite a long time, been through a lot of World Health Assemblies, and I don't think I've ever seen delegations as tuned in to the lessons of COVID and to the fact that it's not over and there's still work to do, and the sophistication of their understanding strategically of what they need to continue, and the fact that I heard so many of them speak to before, when we spoke to ministries, sometimes people would be talking about commodities, or they'd speak about vaccines, or speak about these very specific needs. But more and more this time around, every ministry talking about communications, engagement around communities, talking about trust, talking around resilience, talking around these things that would not have been such a big issue maybe before. And I think the system is learning. And it's really important that it does. And I think it's time now to push more on that, and because I think governments have learned really some very tough lessons during this pandemic, and I think communities have also learned, and we need to really capture that learning. The learning isn't just done in academic units. The learning isn't just done by people writing systematic reviews for some medical journal. There's a different level of learning from this pandemic that's required. And that's deep learning at community level, and governments and others absorbing the lessons learned from communities, not going to communities saying, now here are the lessons we've learned and here's what you're going to do, which often becomes the lesson learned approach. So I sensed across the board a much deeper understanding of that need for engagement and dialogue with communities and with non-governmental organisations, with non-state actors, with youth organisations, with faith organisations. And I think we need to capture that. I think we need to really capture that sense that government has, that it's not in this by itself, that society and communities have things to say, are partners in dealing with health emergencies, as like with climate change and as well. And mitigating the impacts of climate change at community level. So I do, that's what I got from all of that epidemiologic speed dating we were doing during the week, that you get that feeling around something. And I sense something has changed, and that's a window of opportunity. That will close again as other matters come in and economic pressures and other crises happen politically. So I do think it's a time, and people out there, it is a good time to engage with your political leaders and really keep talking about this need to change things for the future, that we can't just stop where we are now. We have to move on and create a safer, better protected world in which every community has a stake.
Sorry, one more thing. There was this forward thinking, that they were saying, okay, we're still in this, but how do we, Mike mentioned the architecture going forward. They were talking about the elements of this pandemic response, and all of this, the complexity of that, and using that as a foundation for the future. And the way that they were thinking through it was quite sophisticated in the sense that it was practical. It was adapting to what they were learning and applying those lessons as they were going through it, and thinking, sustaining that forward. So a lot of people are talking about this idea of a transition. I struggle with that word a little bit, because sometimes people think you transition meaning you stop something and you do something new. But what we are seeing are people really evolving into what is needed and strengthening that, from everything from trust in the communities to the systems that they've built, to the workforce that they are training, through the reporting mechanisms, the electronic systems, to equity. There's just a lot of discussion around that. And I think countries are really working hard to ensure that we don't forget about COVID, as everybody wants to, because everybody just really wants to move on, but that we have to, there's a responsibility that we have to maintain this effort to deal with the now as well as to deal with the future. So that was great for us to hear, because we set policy, we set guidance and policies and strategies at a global level that have to be adapted regionally, that have to be adapted nationally. And it's good to get that feedback to say, are we actually doing something that's helping our member states? And it was quite helpful to hear what we do can help them and helps them do their jobs. Mike, I want to ask you you said something at one of the meetings, and I'm going to put you on the spot here, and you said everybody thinks WHO are people that sit in Geneva or sit in an office. But the way that you described is that we are a member state organization. We're the secretariat of all of our member states. And I don't know exactly how you phrased it, but you were essentially saying that we work with ministries and people all over the world. So essentially, we're all WHO. And I really love that, because that changes the perception about us sitting somewhere in some stuffy office, typing something and telling someone what to do. But we're an extension of our ministries and of the people that we serve all over the world.
Yes, I think I may have used the term shiny arse bureaucrats at one point, which we weren't. We didn't want to be seen as. But it does bring me to that broader issue, because I know, Alex, you were really following this dialogue, this discourse going on, this narrative around the pandemic accord and agreement. And, we saw a lot of activity on social media around WHO's coming to take away the sovereignty of nations. And I think it represents a kind of a fundamental misunderstanding. We are a secretariat.
Sorry to interrupt you, Mike. There are quite a lot of comments and questions around it, so you may want to take time to explain and clarify this issue around pandemic accord. So
yes, because I think it relates to what Maria was saying, and maybe to explain a little bit more what the World Health Assembly is and what WHO is, because the World Health Organization is not a building here in Geneva. The World Health Organization is 194 member states who signed up to a WHO constitution, which represents the collective will of countries of the world to work together towards attaining health for all, towards attaining health as a human right, towards attaining access to healthcare and the best possible levels of health and health protection that we can. We do that by sharing knowledge. We do that by sharing science. We do that by coming together with common strategies. We do that by sharing commodities. We do that in so many ways in terms of policy, strategy, implementation, training, knowledge transfer. And there are different ways to achieve that equity around the world. The assembly comes together once a year and it sets the agenda for the organization. That's why I said there were resolutions and there were agreements and decisions made. And really the assembly works through two things, resolution and decision. It decides to do something, and in a resolution it commits to the detail of that. And in that detail, in a resolution, that will instruct the Secretariat, like ourselves, to develop a strategy or implement a program. It will also commit the member states themselves in that resolution to certain activities. And you'll see in our resolutions, it has what they call operative paragraphs, which basically say to the Director General, do this, to our member states, do that. And it's an agreement between our member states to do certain things, with us as WHO, the Secretariat of WHO, carrying out specific actions on behalf of the member states. And we report back on those actions both through the Executive Board, which is the management board of the Assembly, of the organization, which has 36 members, 6 from each region, and they're member states. So our management board is made up of our member states, and our most important policy environment is the World Health Assembly, which is, we don't have a vote. I don't have a vote at the Assembly. Only our member states have a vote at the Assembly. Only our member states can actually speak to promote or to reject an idea. We don't, as a Secretariat, get involved in that. So that's how it works. And in that sense, the discussions recently on having a new accord or a new agreement between member states that would commit member states to working together on pandemics is just that. It would be under the WHO Constitution, our member states have agreed on a process. It's an intergovernmental negotiating body. Again, we're not part of that as the Secretariat. It is only the member states. And the two chairs of that process are the Netherlands and South Africa. And there's a group that's been put forward from the member states, and they will negotiate whether or not there should be a new accord or a new agreement on pandemics. And that accord or agreement would commit member states to working together in preparing for and responding to the next pandemic or the next big health emergency. It's not about taking away sovereignty from states. It's about sharing responsibility for the health of everybody in the world, and certainly for the health protection of people. We saw in this pandemic, if countries don't work together during a pandemic, we really are in trouble. The problem is we're not working together before the pandemics either in a most effective way. So how do we find ways of working together in a transparent way where we all share responsibility in terms of preparedness and where we can respond collectively when something happens? And in that sense, the accord is more like a commitment to the future. It's a commitment to our children. It's a commitment to the next generations from the member states, I hope, if it is agreed. And in a sense, it says, we promise we will work together before, during, and after the next pandemic. What we work on, how we work on that, what the specific objectives of that work will be is entirely down to our member states. It's not some cabal here in Geneva deciding what's going to happen. And I think it's important that we get behind that principle and that process, because there's been a lot of disinformation out there around what happens. I can, state for the record, I don't own any black helicopters. We're not a clandestine organization coming to take away people's children. Some of this stuff is really damaging and it's really negative, and people's ideas are being manipulated. And this goes against a principle that we collectively on this planet have certain problems that we can only solve together. We can only deal with climate together. We can only deal with pandemics together. We can only deal with conflict and war together. And the theme of this assembly was health for peace and peace for health. And Dr. Tedros spoke passionately of his own experience in that. We have converging risks. We have risks that are intertwined. We cannot separate climate from pandemic from conflict anymore. One is driving the other. We cannot deal with them as purely as nation states. We cannot confront those challenges by all sitting in our own countries saying we'll do something about it. We need collective action. And the Accord is purely the means by which our member states will sit together and agree how they are going to work together in the next pandemic, before, during, and after the next pandemic. And all we will do, as shiny arse bureaucrats that we are, is implement the will of our member states.
Thank you, Mike. I must read what Leslie Emerson wrote about your answer. The depth of your understanding, the complexities of what is transpiring and needed in communities and governments throughout the world inspires me this morning. Thank you all for your deep heart and hard work the last 3 years. Your humility and wisdom is obvious. So I felt I needed to share this after such great explanation and response. But we also have a question from one of our regular viewers, Minat Najen, I hope I'm pronouncing this well, about the public hearing on pandemic preparedness and response that is coming very soon in June. And the question is, what should be expected from those upcoming sessions? There was already one public hearing on a pandemic accord held recently. So I believe this is the second one that should take place.
Really, this is a call for everyone to get involved, and those sessions are purely a public opportunity for everyone to do that. That's not just for organisations, that's for anybody out there to put their head in the ring, take the floor. But that's not the only way to get involved. Write letters, have meetings, do webinars, input every single piece of engagement and communication that you can have on this. The more people, the more organisations, the more communities that touch this accord, the better. It will be better for it. It will be a bit confused for a while because everyone will pile in and there'll be thousands of ideas and it'll run in different directions. We trust that our member states, that IMB, will be able to absorb all of that input and will honour that input through coming up with a proposal that will make sense for everybody. But Tedros has been very clear in this, and so have the member states. They do not see this purely as a mechanism where member states will engage formally in a pure negotiation. That will come. There will be a negotiation because in the end this is constitution. This has got legal implications as well for countries and what they sign up for. But ultimately the process of defining what should be in there, and that's what we need to get to now. The real process now is, what are the most important things that need to be in there? What matters to you out there right now? Does equity and vaccination matter for you? Does access to healthcare matter to you? Does having point-of-care diagnostics? What are the most important elements of that? What are the most important elements of trust? How could governments and WHO improve the way we communicate and engage with communities? What could you see running better? Because at the end of the day, we say it again and again, pandemics begin and end in communities. Ultimately, people have experienced this at a very, very deep personal, health, economic level. And you have a voice in this. You went through it. You experienced it. So you need to tell us, how do you want this to be done the next time? How do you think it should be done? What should be more of? What we should do less of? What we should really focus on? Because it matters. And the idea that this is a top-down process where, people at the top will decide what's best for people in communities, that doesn't work for me. I think there's a reverse learning that's needed here. We need to learn from our communities of the experience they've had, of the things they've seen that have been good, the things they've seen that have been bad, the things they don't want to see in future, the things they want to see in future, because that will feed in. And the more we can democratize that discussion, the better any final accord will be. So this is a real chance, and it's not just this next consultation. Sit down, write an email, put up a billboard, do whatever it takes. Send us a recording of a webinar you've done. Any way you can engage with the process, please do, and we'll ensure constructively, yes, always constructively, and I hope that happens, and I hope that widens and broadens. And it's going to take time for this negotiation to happen. So there's plenty of time to get involved, and please do.
Thank you so much, Mike, and I really hope that our viewers will follow your call to join those public hearings or engage with us constructively through different channels. Maria, we're getting a lot of questions actually about the situation of COVID at the moment in terms of epidemiological situation, but also the latest variants.
So we do have an update. I don't have all of the information in front of me because we have a delay in reporting from one of our regions, so I don't have the overall trends. What I can say is we expect to report a reduction in cases being reported to WHO again. It's week on week we're seeing that. But that is in the backdrop of testing that has declined significantly, changes in testing policies, and changes in reporting. So our ability to really track the virus and its circulation is still compromised. I mean, I've been saying this for quite a few weeks now, and we are concerned about this because this has an effect on our understanding of how intense the virus is circulating, who is most infected at the present time, and also our understanding of the variants themselves. We can't sequence who we don't test, and we can't analyze what we don't sequence. So we're losing that ability, and that concerns us because the virus is still spreading at a very intense level. We do see a reduction in hospitalizations and in deaths across several of our regions, with the exception of the Western Pacific, where we've seen a 20% increase in deaths, and Africa, where we've seen a 12% increase in deaths. So not everywhere are we seeing this emergency end. We are still seeing, around 10,000 people dying per week that we know about. This is unacceptable when we have tools that can prevent this from happening. It's about who we reach with these tools. It's about who we miss with these tools. And this is why it's so critical that countries not just look at the coverage level that they have, which is important, but also look within that. Have you reached 100% of your at-risk population? And most countries have not. So we need to get down to that level of detail. So it's still quite dynamic. Millions of cases being reported every week. At least 10,000, deaths that are occurring each week. And hospitalizations in some countries are still quite high. We still see people who are not vaccinated who are requiring hospitalization. Omicron, the variant of concern, and BA.2 in particular, is dominant worldwide. That is still the case based on all of the sequences that we have seen and all of the sequences that have been shared on platforms like GISAID. We are seeing an increase in the number of BA.4 and BA.5 that are being reported, but it's still a few thousand sequences, not tens of thousands at the moment. We did have some good news from South Africa, where they have been tracking very, very closely their wave of BA.4, BA.5, and they've passed their peak of infections. And they did not see an increase in hospitalization, and that's a good sign. Because they have population-level immunity from past infection and their vaccination coverage is increasing. Across Europe, and with the summer months ahead, with people mixing, and with not a lot of measures in place, the virus will thrive. The good news in some countries, and particularly across Europe, although there still are pockets of missed people, vaccination coverage is increasing. The amount of boosters that have been administered is increasing. But we should make no mistake that COVID-19 is still devastating societies. This is still a public health emergency of international concern, even though some countries are having such positive impacts because they have their high vaccination coverage. That is not the case everywhere. And that's why we continue to advocate for this, and we continue to ensure that people, pay attention to this. But the variants are something that is, really an important consideration for us. We've just published an article that summarizes why we need sequencing to be at a high level around the world so that we can continue to track Omicron and all of the sublineages there. There are many studies that are underway looking at some of the details of each of these mutations, and we're looking at whether or not we can be in a position to predict what might come next. Unfortunately, we can't do that with any certainty, but we expect the variants, more variants to be identified. Likely will be more transmissible, but we don't know whether or not they will be more or less severe. Good news is that we still have tools that work, and our vaccines, the COVID-19 vaccines that are out there, are incredibly effective at preventing severe disease and death against all of the sublineages of Omicron. So when it is your turn, get vaccinated. Even if you have been infected in the past, it's important to get vaccinated when you can and to make sure you follow the guidance in your country on how many doses that you need. Vaccines save lives, and that's a really important message we want to continue to get across.
Thank you so much, Maria. And speaking of vaccines and tools, we have Cindy watching us on Twitter who is asking, why are people still contracting COVID-19 even they have already been vaccinated and boosted? So, Mike, maybe you want to take this one and explain that how the current vaccines work.
First of all, no vaccine is 100% effective. Vaccines are biologic products, and there are factors in the human being and factors in the vaccines that may mean that someone doesn't get a full immune response to being vaccinated. That can often happen in people who have weaker immune systems, and that's why we see the need to boost people who are in older age groups or people with underlying conditions, sometimes immunosuppressive conditions. So first thing is to get an immune response to the vaccine, in other words, that you actually react to the vaccine. And then the second is what levels of antibodies you develop and what level of protection you have from that. And what we've seen with the vaccines, they were designed to save lives and stop hospitalizations. They do, to an extent, prevent you being infected and prevent you transmitting the disease on, but they don't give perfect protection. And that's probably because a lot of the main infections in the mild cases are really on the mucosa. They're on the surface of your respiratory airways. They're on your, in that sense, they're superficial infections that cause that sort of mild infection. Whereas what the vaccines very often do is provide that deep immunity, that humoral immunity inside your body that prevents you having that much more severe course of disease. We may see a future in which we get vaccines that do protect against infection and transmission, particularly nasally applied vaccines that we saw this with oral polio vaccine. Injectable polio vaccine historically prevents you from being paralyzed, but it doesn't prevent you getting infected and passing the disease on. So for polio eradication, we've been using oral polio vaccines, which actually give you immunity in your gut. So in that sense, we haven't come up yet with a vaccine that's perfectly adapted to giving you immunity in your respiratory airways. The current injectable vaccines give you very high levels of protection from serious disease, but don't necessarily protect you from getting that respiratory infection. For most people, that's just a mild infection. So they say, I've been vaccinated and I got sick and I had a fever and I had a sore throat and a runny nose for a day. What I would say to those individuals is, well, aren't you lucky you were vaccinated? Because if you hadn't been vaccinated, that could have been a much worse disease for you. For those people who've had severe infections after being fully vaccinated, there's always a chance that the vaccines just didn't work for you because of some underlying condition, again, because you didn't mount an immune response. And that's why governments have been very focused on getting booster doses into the most vulnerable populations and vaccinating people multiple times, most cases a third shot for the 2-course vaccines, and in some cases now a 4th shot for the most vulnerable. And even that doesn't give you an absolute protection. But what we do see when you look at hospitalized patients or patients who die now, your chances of being unvaccinated, if you're unvaccinated, you're 30 to 50 times more likely to end up in hospital or end up dead. That's the reality. So yes, you will find people amongst the hospitalized cases who are vaccinated, but the vast majority of people are unvaccinated. And that's the issue. The vaccine gives you a very high level of protection, but that protection is not perfect. It's like putting on a seatbelt. That provides you with a certain level of protection. A roll cage provides you with another level of protection. But in the end, there's no level of protection that's 100%. But that is not an excuse for not wearing your seatbelt. Just because your seatbelt doesn't give you 100% protection, you don't say, well, that's not 100%, so I'm not wearing it at all. That's not how humans think. So I think we have to start thinking about this like we talked about risk before. How do I reduce my risks? The single best way you can reduce your risk of getting very sick, getting hospitalized, ending up on a ventilator, or ending up dead is to get properly vaccinated with an effective vaccine. That is the single most effective thing you can do, especially if you're an older person or in a vulnerable group. Will it give you absolute guarantee? No. But will it give you the best shot you have? Yes. And that's all I can say, to be transparent and say nothing is perfect. As I say, I don't get in my car and drive and take my seatbelt off because it's not 100% effective. I know it will save my life in an accident. And that's why I continue to wear it, even though I know it's not 100% effective.
Think,
And I think that's
please.
the big point, because I think that's the main thing people are saying, well, if we're just, if the virus is here with us and we can't get rid of it and I might get infected again, so why bother? But that's exactly the point of what Mike just said. Like, these vaccines are not 100% perfect at preventing infection, but they are really incredibly effective at preventing severe disease and death. And we forget that this is quite astonishing, that we have so many of these vaccines that work so well. We knew in the beginning of this pandemic, we sat in meeting after meeting after meeting and said, we might not get a vaccine that works. We might not actually have this tool. And the fact that we have so many that have such high levels of efficacy is really quite astounding. So while this virus is circulating and you may get infected even if you were vaccinated, but those vaccines are saving lives and they will save your life. The chances that they will save your life are, what did you say, 30 to 50% higher? 30 to 50 times higher, excuse me, or even higher than that, depending on what risk group you might be in. So it's worth it. It's worth getting that vaccine. So many people have worked so hard to make sure that they go through the rigorous process of development and the safety checks, and billions of people now have been vaccinated and they have an incredibly safe profile. So get vaccinated when it's your turn. But keep in mind, this virus is still with us and it's still circulating. So you might get infected, and that's why we want to make sure you know what your risk is and you lower your risk. Get vaccinated, make sure you get those full doses, but also take some precautions, particularly if you live with vulnerable people. Because it's not just about you. We've said this a lot. It's about you and it's about the people who are around you, to make sure that if you do get infected, that you don't pass it to somebody else. So there's still lots that we can do, and we're not giving up.
And we don't, again, we've said this here before, this isn't about taking away people's freedoms,
No, not at
rights,
all.
or lives. This is about, more and more we're speaking with ministries of health and others and working very hard on integrating all of these COVID-type measures into the normal health system, so vaccination been integrated into the immunization system, clinical care been integrated into primary health care, so that next winter in many places, when you go to your GP, you'll be able to have your test on the spot and get an antiviral there and then if you're in a vulnerable group. So thereby, we talk to many countries, the Netherlands, Malaysia and others, who are trying to put their primary healthcare system, strengthen it much more so it can deliver a higher level of care early in the course of the disease. So what we have in many places now is some breathing space to get better ready, but to integrate our surveillance. So we're not just doing surveillance of COVID, we're doing it for flu and for RSV virus and others, to integrate our clinical care. So that in Africa, for example, we're treating HIV, TB, malaria and COVID in the primary healthcare setting. So the work at the moment is to try and bring what was necessary, a big pandemic response for this big one disease, to try and bring this into the system. So number one, we can sustain the effort within the system. And number two, we can use that momentum to strengthen the other parts of the health system. So I hope what we're doing is eventually COVID becomes just another disease. It will stay around for a very long time. It will be with us. It may come in waves. It may increase in winter. There may be pockets of intense transmission from time to time. I don't think we can avoid this. But what we can avoid is the carnage associated with that, the health, social and economic consequences of that. That's what we have to manage. We don't live in fear every winter of the flu. We don't live in fear. People in Africa, malaria takes a terrible toll, but people don't live in fear of malaria. If you have access to bed nets and you have access to treatment, then mortality goes way down, and then malaria becomes a risk, but it's a risk that's managed in the context of your community. It's a risk you can accept, and life doesn't have to stop. So we need to normalize that approach to COVID-19, integrate that with the management of other respiratory diseases, and make our healthcare systems more responsive and able to deal with COVID as a normal disease. And I think we're getting there slowly on it. That's going back to the Health Assembly, Alex. I could feel that coming from the ministries. I could sense that sophistication in their approach. But sustaining that and sustaining the surveillance and the genomic sequencing and the tracking of the variants, moving those antivirals to the point of care with diagnostics, continuing to increase vaccination levels, particularly in the most vulnerable. I know we keep saying this, I feel like a long playing record. But epidemic control is it's very easy to describe, but it's really hard to deliver. It's really hard because you just got to keep doing it day after day. You just got to, do, stop, repeat. Just keep going the whole time. And if you do that enough, if you continue to apply those measures and those principles, the disease eventually either disappears or becomes part of the normal architecture or the normal background radiation that we have of infectious diseases. And I think we can achieve that. And I think we can achieve that this year, notwithstanding some of the more severe scenarios that could occur. But I don't think the ordinary person out there needs to sit up at night wondering whether the doomsday variant is around the corner. That's not what people should be concerned about. Maria said it quite correctly. Look around you, yourself, your family. Am I protected? Have everyone around me got vaccinated? Right? Do I have access to a good family physician if somebody gets sick? Am I able to access care if needed? Am I willing to self-isolate myself if I too get sick so I don't continue to spread this disease? Look around you and your world, your environment. Agitate and fight for the services that you need, and advocate for those vulnerable people in your community who do need that in long-term care facilities and others. So take part, be active. But this will be solved community by community. And if everyone today looks around them and says, are the services in my community that we need? Is the surveillance in my community that we need? Are we getting the information that we need? Then I think it builds up in a patchwork to a global effort. We have to move away from this global sort of top-down strategic approach and move much more into community integration of all these COVID measures.
Last question before we close, because we are running out of time, is, Maria, maybe you can clarify this. What is the secret that all WHO people are safe from COVID and other common public people in general are dying across the globe? So I think this is a... So I think that there is a wrong impression. It's not very clearly written, but my understanding is that there is a wrong impression that WHO people working in WHO are safe from COVID in comparison to public and others who are getting infected and dying.
We are just like everyone else out there. We have jobs, we have families, we're just like you. So we follow the rules that we are suggesting to everyone else who are out there. Get vaccinated when it is your turn. Make sure that you receive the full dose so we get vaccinated. We are so fortunate to live in a country where we have access to health care. We have access to tests if needed. We have a staff health and wellness that's here that look after us. Many of us at WHO have worked from home. Mike and I and you in this room are not some of those who've teleworked for a couple of years. We've come into the office, but we are fortunate to be able to do so, and others are teleworking from home. We're just like you. We have families and kids, some of whom we haven't spent a lot of time with in the last couple of years. We have parents and grandparents and aunts and uncles, and we miss them. So we're exactly like you. There's no difference really here. I would say we are incredibly lucky where we work. We have people around us that support us, that look after us, check in on us, make sure that we're doing okay with all the pressure that we're dealing with. We, as I said before, we have access to health care. We have access to hospitals and medicine and tests if we need them. And we live in a country, where we can receive food, and we're not at war. So we're very, very fortunate to live where we live. But we struggle just like you, and we reach out for help just like you. So you see us sit here and talk and try to talk confidently, try to talk with humility, but we're people too. So we're struggling as well.
And remember, again, the WHO Secretariat, who we are, we're just, in our program, the emergencies program, I think we have about 3,500 people working all over the world, from Ukraine to Syria to Yemen to Cox's Bazar, all over, Mozambique, everywhere. Incredible number of people. There's only about 550 of those, but 17% of our workforce works out of Geneva here. The real heroes, in my view, are many of those staff who stayed out in very difficult duty stations right in the middle of COVID, were not able to get home. There were staff in the most extreme circumstances. There are some of our duty stations where you absolutely have to take a break every 6 weeks. It's so demanding, it's so stressful, it's so dangerous that you're forced to do R&R, not forced, but some of us feel forced, but it's a health and safety issue. And yet there were months and months where people were stuck. They couldn't get flights, they couldn't leave, and then many came out and then went back. And I, to me, they're incredible. The UN NGO partners around the world, who many of whom, spent some of them up to 2 years away from home because they couldn't go home but they stayed at their duty stations. They stayed in service of communities, and we had to evacuate so many different ones. We have a global system for managing sick UN staff, and we had UN staff who died in the field from COVID and others, and they did that thousands of miles away from their families. So I do think we are just as susceptible. We are in a little bit of a gilded cage here in Geneva. The real heroes of our system of WHO, the UN system in general, are those staff who serve on the front lines in Afghanistan and Syria and Yemen and Somalia and South Sudan, and working with communities on the extremes. They've been remarkable because they've had to keep providing humanitarian assistance in the midst of COVID-19 with all of the restrictions, with all of the compromises, and they've done a remarkable job in doing that, and at least trying to continue to provide that assistance to people in very difficult circumstances.
Thank you both, and I would just maybe add that we had a lot of staff members who got COVID here as well, and the staff health and wellness service is also doing still the contact tracing. So if we are a contact of a colleague who get infected, we need to stay at home still for 2 weeks.
We follow our rules.
Exactly,
Yeah.
we follow still those rules. So just maybe to clarify for our viewers. Thank you both for your time. We are out of time, and I thank to all our viewers who have asked their questions and who watched us today. Please keep following us until next week and stay safe.